Hi, my name is Marijn Warners. I'm a PhD candidate at the Academic Medical Center in Amsterdam, and at the moment I'm working on my thesis on eosinophilic esophagitis. I will now shortly summarize the highlights of my recently published article. Disease activity in eosinophilic esophagitis is associated with impaired esophageal barrier integrity. EOE is a chronic immune-mediated allergic disease of the esophagus, probably caused by ingestion of food allergens. EOE is clinically characterized by symptoms of dysphagia and food impaction, and histopathologically by the presence of more than 15 eosinophils per high-power field. Unfortunately, there's not such a good association between symptoms and histologic disease activity, and therefore repetitive endoscopies with biopsy sampling are required to monitor disease activity and evaluate response to treatment. However, complete reliance on histology has limitations. First, EOE is a patchy disease and the eosinophils are unequally distributed across the esophageal mucosa. Second, the thresholds of active disease is chosen rather arbitrarily. So, this suboptimal approach does not only result in significant patient burden, but also in considerable cost to the healthcare system. In patients with active disease, the mucosal integrity is impaired, which may eventually facilitate transepithelial allergen passage and activation of the immune system. However, it's unknown whether the impaired barrier integrity is the result or the cause of the inflammation. But either way, it may be an important marker of disease activity. Recently, the electrical tissue impedance spectroscopy, or ETIS, has been developed to measure mucosal impedance in vivo during endoscopy. This less invasive device allows multiple measurements of a greater area of the esophagus without injuring the mucosa, so this may be a less invasive and less expensive disease activity index. Therefore, the aims of our study were to assess the correlation between esophageal eosinophilia and various measurements of mucosal integrity, and to evaluate whether endoscopic impedance measurements can predict disease activity. Endoscopies and mucosal integrity measurements were performed in adult EOE patients with active disease, defined as more than 15 eosinophils per high-power field. At baseline, we evaluated those measurements in patients after treatment, either after topical corticosteroids or after an elemental diet, and we also compared values with those of healthy controls. Mucosal integrity was evaluated during endoscopy using electrical tissue impedance spectroscopy, the ETIS. With the ETIS, you inject an alternating current via a probe that is placed against the esophageal mucosa. Transepithelial resistance and transepithelial molecule flux through biopsy specimens was measured in assay chambers. To determine the optimal cutoff values of endoscopically measured mucosal impedance for distinguishing active disease from remission, receiver-operator characteristic curves were constructed and areas under the curve were determined. Sensitivity and specificity were calculated by cross-tabulating values greater than or less than the mucosal impedance cutoff value for histologic disease, the reference standard. In total, we included 61 measurements, 32 of patients at baseline and 29 of patients after treatment. 3 patients dropped out. We also evaluated 19 measurements of healthy controls. After treatment, 20 patients were in remission, and these measurements were compared with the 41 measurements of patients with active disease. All 4 mucosal integrity measures showed significant impairment in active EOE compared with remission. Eosinophilia was negatively correlated with ETIS and transepithelial resistance and positively with the transepithelial molecule flux. All were highly significant. The optimal ETIS cutoff to predict disease activity was 6,000 ohm, with a sensitivity of 79, a specificity of 84, positive predictive values of 89, and negative predictive values of 71. We confirmed with our study that the esophageal mucosal integrity is significantly impaired in active EUE, and that in vitro and in vivo parameters of esophageal mucosal barrier integrity inversely correlate with the degree of inflammation. The findings of our study suggest that mucosal impedance is a promising predictor of disease activity and that it can accurately differentiate active disease from remission. However, next-generation impedance catheters should determine whether ATIS is a technique that could replace biopsy sampling in the near future. Thank you very much for your attention.